So the first thing to do is to determine the availability of the equipments. So the equipments are the patient's chart, the stethoscope for auscultation, the tape measure for identifying the fundic height, and the pillow for the later to avoid the supine hypotension. So there are three procedures that I'm going to demonstrate. The first is the Leopold's maneuver. The second is the fundic height measurement, and the third is the fetal heart tone monitoring. So the Leopold's maneuver are used to palpate the gravid uterus systematically. This method of abdominal palpation is of low cost, easy to perform, and non-invasive. It is used to determine the position, presentation, and engagement of the fetus in the uterus. So there are safety considerations in doing the Leopold's maneuvers. First is that we cannot perform Leopold's maneuver with a full bladder at all. So therefore, instruct the patient to empty the bladder. Second is the privacy of the patient should be another most priority. Therefore, drape properly. Third is to explain the whole procedure to the patient in order for us to gain cooperation or participation during the procedure. The last is to palm should be used to palpate instead of the fingers. So the first step in the assessment is to check the vital signs of the patient. So the first thing to do is to check the blood pressure of the patient. So ma'am, I'm going to check your blood pressure. If it's okay to you, ma'am, I'm going to do the procedure. Okay. After checking the blood pressure, take the note of it, then proceed to checking the mobility status. So ask the patient if he or she can stand by herself. So, ma'am, can you get up? So, the next step is to ask her previous clinic visits. So, ma'am, when was your last checkup?
December.
Then, the next step is to ask her last menstrual period. Ma'am, when was your last menstrual period? After all of those assessments, we are going to proceed in computing the age of gestation. So, hi ma'am, I'm Dana Luis Luginsa. I'm a student nurse from Davao Oriental State University. So, for verification purposes only, may I know your name and birthday? Thank you, ma'am. So the next step is to explain to the client what are we going to do and what is it necessary to perform. So, allow me, ma'am, to explain what are we going to perform and what is it necessary. The Leopold's maneuver. It is to determine the position of the baby or how many fetus are inside of your womb. So the next step is to ask the client to empty her bladder. So ma'am, before we do the procedure, may I ask you to urinate first because it might cause you discomfort during the procedure. So the next step is to perform the hand hygiene and observe the infection prevention control. So the next step is to prepare the client and assist her in supine position while the knee is slightly flexed. So put a pillow or a rolled towel in under her knee. Then provide privacy to the patient while draping it properly. Next step is to expose the area that needs to be assessed. So we should ask the patient with her consent to bear her cloth for assessment. So, ma'am, may I lift your glove for the abdomen assessment? Thank you, ma'am. The next step is to observe the woman's abdomen for the longest diameter and where fatal movement is apparent. Then the next step is to grab the hand palm to palm in order to avoid contraction to the patient. Performing the first maneuver, which is the fundal grip. So first, we should face the patient, head part, then create a little triangle and put it on the top of the fundus to palpate. It is to determine the consistency, the shape, and mobility. So the second maneuver is the umbilical grip. Still facing the woman and palpate the other side in order to determine the back of the fetus. Apply gentle but deep pressure and palpate it into the other side. Again. Is the pollix grip. So in this maneuver, while facing the woman, grasp the lower uterine segment between the thumb and the fingers in one hand, just above the symphysis pubis. Move it to the side by side and then identify correctly the presenting part. So, from the previous maneuvers, we are facing the head part of the patient. So, in the last maneuver, we are going to face the middle part of the patient. So, in this maneuver, we should place the palm of the sides of the abdomen just above the inguinal ligament. Grasp snugly the lower abdomen and with the outreached thumb, hitting the umbilical level. Place the fingers on both sides, approximately 2 inches above the inguinal front ligaments, pressing the downward and inward in the direction in the birth canal. Using the tape measure, we measure the fundic height from the symphysis pubis to top of the fundus using the centimeter length. Next step is to document the measurement in centimeter in the chart of the patient. Using the stethoscope, we auscultate the fetal heart tone of the fetus. Rate of the fetal heart tone. Next is to make no unnecessary exposure of client's body and return to position. Then the next step is to explain to the woman what are the findings after the whole procedures. After the assessment procedure, the findings are normal. The findings are normal. Okay. So after is to do the hand hygiene, and the last thing to do is to document the results.